We are looking into issues around those of us who wear glasses, who have some kind of vision impairment, and those are around the conversations that we will be having today. Two gentlemen are in the studio with us, and as we start that conversation, we're saying a big hello to Ashihundu Khayumbi, who is a general manager, Royal Eye and Ear Hospital in Parklands, and Dr. Abdelalim Tolba, who is a consultant ophthalmologist and an Egyptian professor. Gentlemen, good morning to both of you. Good morning to you. Karibu sana. Santi. We are glad that you're here. We waited for you, but we're glad that you made it all the same. These are the hot seats of the Situation Room. This morning, of course, being Friday, Healthy Friday, takes us now. We're looking into issues around error of refraction, defective vision, and really what this actually means. Sometimes we say, well, I can't see, perhaps I need glasses. We're going to go a little bit deeper into all of this today and see what that looks like. So very quickly, one thing that we do when we welcome you to the show is that we say we have a proverb that comes from a different African country every week. Today, as we end the week, Mark is going to tell you where that proverb is from, and we would like you to give your simple interpretation of the same. Is that all right?
Yes.
All right. Okay.
Well, a good morning to you, gentlemen.
Good morning to you.
I am glad because this room is 3 out of 5 wear glasses. So, so when you look at your map, there's a country called Libya at the top of Africa.
Yes.
Now these people wear turbans, right? So there's a saying that says, where the turban moves, there moves the territory. Where the turban moves, there moves the territory. Yes. What's your interpretation?
Good morning. As he has said, where the turban moves the territory. This means that leadership, the turban is a sign of leadership. Yes. So where the turban moves, that's where the leadership moves.
Okay.
Yeah.
Okay.
And everybody else follows.
Yeah.
Yes.
Okay. What about you, Doc?
Yes, so the turban moves, the leadership follow.
Yeah.
Yes.
Where the turban moves the leadership,
Yes.
then the territory follows.
Yes.
Well, that's what we look at, just taking turban as a form of symbolism. So we're getting into a conversation, obviously, about vision this morning on our Healthy Friday conversation.
Yes.
And with both of you here, we'll just get a little bit more understanding about what this is all about. And we're going to, bring in issues that a lot of us sometimes hear, say, and are not really sure what we're dealing with. First of all, let's start with the error of refraction.
Yes.
First of all, what is refraction? What does that mean from a descriptive point of view? We'll start with you, Dr.
Yes. I can start that the function of the eye is to vision. So to see anything, there is rays coming from this object and coming to the eye, refracted through or collected through 2 lenses in the eye. This is the cornea and this is the crystalline lens. The rays coming from the object collecting together to meet at a point at the retina. This is the normal position or the normal condition. Diminution of vision or decreased vision may be caused by either diseases in the eye or a defect in these 2 lenses. Any defect in these 2 lenses causing what is called error of refraction.
Okay.
That's to say there is a specific bulging of the cornea or curvature of the cornea and also of the crystalline lens. If this curvature defective or affected by any disease, so the rays coming from the object not meeting at a point on the retina, either in front of the retina, which is called myopia or nearsighted vision, or hypermetropia behind the eye like myself, or not collecting at a point, but in the multiple points. So it's called no point or astigma, no point. Okay. This is astigmatism. So myopia, hypermetropia, astigmatism is one types of errors of refraction.
Can we just take that slowly? Let's start with myopia.
Yes.
Which I know very well because I suffer
because
from
you
it.
are myopic. Yes.
But so that's nearsightedness.
Yes.
Now you've used some fancy scientific terms.
Yes.
But if we were to put it in layman's terms, when you talk about the light hitting the retina,
Yes.
that it is short.
Yes.
So I can only see things that are near.
Yes.
I cannot see things that are.
Yes.
Okay.
Because
Uh-huh.
nearsighted vision is the person who can see near vision, near object. To see far is a difficult because
Yes.
rays coming from far is collecting in a point away from the retina, in front of the retina. For this reason, we find a solution, either putting a glass to making the rays passing behind to collect on the retina, or another solution by a contact lens or a refractive surgery, either surgery over the cornea or surgery over the crystalline lens. These are the procedures, either glasses, contact lens, or a refractive surgery over the cornea or refractive surgery over the lens,
Okay.
which is called LASIK or other modalities of the correction of vision.
Okay. Before we go to corrective measures for each of these
Yes.
errors, what was the next one that you talked about after nearsightedness?
We can speak about hypermetropia,
Okay.
farsighted vision, astigmatism.
So far-sighted vision
Yes.
is when you cannot see things that are near,
Yes.
but you can only see things that are far.
Yes.
Okay.
Yes.
And then what was the other one that you spoke about? Astigmatism. Okay.
Astigmatism is different curvature of the cornea, so the ray is not collecting in a point, but in a multiple points. And the astigmatism is stigma a point, not collecting in a point. It is astigmatism.
Okay.
And the translation in Arabic, لا نقطية. It is not a point. It is in a multiple points. For this reason, astigmatism find a difficult, either in near or in far.
Okay.
And causing a headache during his work or calculations or
So
study.
there's no focus in vision.
Yes, not focusing on a point.
Can you have nearsightedness or farsightedness coupled with astigmatism?
Astigmatism is a coupled, either nearsighted astigmatism or farsighted astigmatism also.
Okay.
Or a combined or mixed.
Okay.
There are many types.
All right.
How does one get to know? Because it took me years to discover that I had astigmatism.
Yes.
And you guys are saying that you're bringing all this new knowledge into the field and things like that. How people listening today who find it hard to read and they've gone to the opticians, as Kenyans usually do, and then you get a pair of glasses, then you're told 0.5 plus minus whatever.
Yes.
How do you know that you've got a more complicated refractive problem?
Yes.
Either can
This is during his work or during student is studying or during his presence in the class. He can't see well in the board. He can't study well. He can't find the figures in a good manner, or complaining of headache or blurring of vision. So he asking about a solution for this, either a defective vision or a headache or blurring during reading or writing or studying. So he go to the optometrist or the ophthalmologist to searching about a solution for this problem or this issue.
So how easy is that now?
It is a very easy.
Okay.
Because there are many solutions. If you go to the optometrist or the ophthalmologist, he can diagnose that the cause of defective vision not related to a disease, but related to a defect in the refraction. So he will find a solution for him, depend on the person. There are different modalities, depend on the person himself. Some person is suitable for him the glasses. Another practice sport, he can't wear the glasses during sport.
Exactly.
So he want another solution, like a contact lens. Another person has a allergy from the contact lens, so he's searching from another solution like LASIK or excimer laser surgery. Another person has a very high myopia, unsuitable to do LASIK for him. We can doing implantation of intraocular lens inside the eye and finding a solution. So depend on the personnel, his job, his characteristic, his complaint, and his age also, and the degree of error he has. We can decide the best solution for him.
So you just said something pretty fast there, that you can put another lens in the eye.
Yes, yes.
Okay, how is that?
The eye has as I said, two lenses. The anterior part is the cornea, and to consider the lens, and his crystalline lens. If this person has a very high myopia and can't be corrected by LASIK, which is limited now to around -7, -8, and he has -15 or -20, we can inserting another lens just in front his crystalline lens to correcting this. So instead of making a surgery over the cornea and not correcting this high error of myopia, so we can not touching the cornea at all, but inserting intraocular lens inside the eye for correction of these high myopic patients.
Okay.
And this is for all three conditions: astigmatism.
Yes, especially for the high myopia. Especially for the high myopia. But
Okay. Ashihundu, do we see a lot of people coming into the facility with errors in refraction, vision problems? Are we seeing that number increasing over time?
Yes, the numbers are increasing over time, and you find that even some of us, like me, who doesn't have glasses, maybe have not just gone for the consultation with an optom or the ophthalmologist, but the numbers are increasing even in schools, because as we are we are running a program called camps. We are doing camps, medical camps, in villages, in estates, in schools, and from these camps we are discovering that majority of people have these issues, but now they are not addressed because maybe it's out of ignorance, or maybe they don't know what to do.
Okay.
I have a question, because this almost feels like a consultation. Because I don't know whether I have an eye problem, to be honest. I spend so much time on the computer, many hours, and lately I'm discovering, I used to see old people hold their phone like this.
yes.
And I'm wondering, why do you pull it away?
Yeah.
Yes.
So now I'm discovering if I put my phone like this, I actually can't read. If I put it like that,
Yes.
then I can read.
Yes.
Do I have a problem?
Oh, Dennis.
Poor.
It's like free consultation.
Go pick.
No, this is not a problem. This is
Okay.
what is called presbyopia. Normally, each person until 40, he can see well for far and for near, because there is accommodation. Like in the camera, you can focus on a far object and for a near object. When you focus on a near object, you're changing the focus for the camera. And this is what's occurred automatically in the human being until 40. After 40, there is solidification of the lens. To focusing the lens rapidly, automatically, to see the near vision, it is difficult. So we must adding an extra lens in front of the eye after 40, 45. This is what is called near glasses vision. For this person, after 42 years, he can see well for far and he can read everything. When he want to see a near object, either he making things just away or putting a near glasses to see well.
You know what? Let me shake your hand. You've explained it. I turned 40
Yes.
and that's when I discovered I have that
Yes.
issue.
Oh, yeah?
It's just said 40.
Yeah.
Yes.
So then, my next question is,
Yes.
it's the first time I've heard the term
Refractive.
refractive error.
Refraction, yes.
So how many types are there? And you talked about the medical camps and you've said you're going to schools. How many, which ones are common in Kenya?
Yes.
Yeah.
The majority is myopia and astigmatism. Presbyopia, which occurred after 42 years, this is a normal physiological condition occurring in all person. You find all person above 40 or 45, if he want to see well reading, he can precede the object or in a bright light or adding the reading glass. So the majority in the schools is myopia and astigmatism. But for high people, old people, is the presbyopia, which needing the near reading glass.
Younger population
Yes.
seems to have issues with vision, which was not the case before. I remember being in first grade wearing glasses, and I think I was the only one for a long time.
Yes.
And now we see many, many more younger children
Yes.
wearing glasses. Is there something in the environment? Is there something going on? Are we having more children born with vision errors? What's happening?
This is what's called congenital condition.
Okay.
This is one type of congenital myopia, meaning that the parents were myopic, so the children, some of them will be myopic. And this type, which is called congenital myopia or congenital error of refraction. So the child born with the myopia, and with the time, the myopia increases with time, starting, for example, by -2, -3, but with the time, there is increasing in the degree of myopia.
Can you stop it?
Sometimes it is at certain age, it reaching to a stable level. Around 15, 16 years old, it stopped to a limit. But sometimes there are another type, which is called the malignant myopia, which will increasing to a higher level, which indicating a very high myopic condition.
Okay, so then how you see the manifestation of that? Because, I mean, I'll use myself as an example. Sometimes it's the example that makes sense.
Yes.
That from the age of 8, by the time I was turning 9, every year I had to go see my doctor.
Yes.
And I got new glasses
Yes.
every year because I needed a higher power to then be able to see. And this happened maybe every year until about 18.
Yes.
But then after that, it became maybe 3-4 years
Yes.
before before I'd need to change the power.
Yes.
And then by the time I got to 25,
Yes.
maybe I would just go in for an eye checkup, but
Yes.
wouldn't have to change the power of the lens.
Yes.
Until much older, then I needed to maybe then make sure that you were seeing properly. Is this what you're talking about?
Yes, this is the congenital myopia, which increasing with age, and usually with the first years, there is a progression in the myopia. Every year, there is a change until reaching the age of stability. Stabilizations around 19, 20 years old. Around 20 years old, there is a stabilization of vision, and this is the age which we decide to do LASIK, because we are sure that the vision is stable now, and this is the time to enter to doing LASIK. If we do LASIK, for example, before at 15 or 16, yes, we will correct. But after that, because the vision is still unstable, there is some regression of vision, which he need after LASIK. Even after LASIK, if done LASIK early, he need a glasses after that. So it is better to wait until stabilization of vision, which will be around 20 years old.
Okay.
Perhaps a question for you, Wanajiem. The cost of correcting these errors, are they covered by SHIF? Does insurance cover it? This LASIK surgery that is being mentioned, is it affordable? Is it within reach of the average Kenyan?
Yeah, thank you for the question. Like we said earlier, we are Royal Eye and Ear Hospital. We are in Parklands, and our specialties are eye and ear. I go to your question now. You asked about if we are doing these corrective surgeries. Yes, we do corrective surgeries, and these corrective surgeries are covered by SHA. Yes.
Okay. And other insurances, and are they affordable?
We have other private insurances that cover these surgeries. So any surgery is covered in a hospital either by SHA or by private insurances or by cash.
Okay.
Yes.
My question is, because Undo has been talking about children. I know someone who was actually a 2-year-old, and I see the challenges. My question is, what are the early signs for a parent when they have a child? And I have to read because I'm trying to remember. Refractive error. What are the early signs for a child? For an adult, there's a way you can go for consultation and you can tell. But you have a child, you're not too sure what signs to look for. What are those early signs?
Early signs is a defect in seeing things or screwing his eye to see things. If I go to the school and looking to the student and seeing one student or some of them screwing his eye to see what is written on the board This is one sign of he can't see well. So he wanted to decrease the light
Make it
entering
sharper.
into the eye to be sharper vision.
Yeah.
This is one sign. Or when you introduce something to him, he nearing the object toward his eye. This is signs. Either defective in lightening, not seeing well over the port, either screwing his eye or coming the object just near to his eye. This is a sign.
Okay.
For this reason, if parents see these signs, he must direct to the ophthalmologist to diagnose the case and diagnose what the child have. Either error or a disease.
Or a disease.
Yes.
Okay. So one thing that we hear, I don't know if it's in my house. Parents used to say it all the time, and I don't know if it's true, but you're here to tell us. They would say, well, don't sit too close to the TV because it will spoil your eyes. Yes. Without realizing that at that point, I was sitting so close to the TV because I couldn't see the thing. Yes. But we now hear it that don't hold the screen too close, it's going to ruin your eyes. Yes. Or don't sit too close to the TV, it's going to ruin your eyes. Is there a connection between lights, computers, now we're using them all the time, gadgets,
Yes.
that would then affect the refraction?
Yes.
Is there a connection?
Really, there is no a connection between a refraction and seeing the television.
Okay.
But sometimes there is an allergy from the rays. And also, the eye is a ball, which is controlled by a group of muscles. During seeing something, these muscles are contracted all the time. And any muscle like our arm muscles, with a long time contracting, there is a fatigue. So, after a longer time of reading or studying, there is a contraction in the muscles. So what occurring, what is seeing running of letters. You see well, but sometimes the letters are running in front of you. You're not concentrating well because of the fatigue of the muscles of the eye, which is contracted for a longer time. For this reason, we usually advise the student, he can study for 1 hour, 2 hours, and taking a rest for 5 minutes. These 5 minutes rest, giving a rest for the muscles of the eye, and he can continue for another 2 or 3 hours.
Okay, so that's good news to know that watching TV didn't ruin our eyes.
Exactly. You don't know what you've done. I mean, I'm feeling guilty.
Because we were accused of watching too much TV because I got my glasses when I was, 10 years old.
I've always believed it until 2 seconds ago.
Exactly. Yes. I need to send my mom a message.
Yeah, stop disciplining your children for wrong things. Yeah. What other myths exist about eyesight that need to be dispelled? Because we live in Africa, there are lots of things that are traditional and some that are based on technology. Phones, for example, are a big thing. And then you are told you need to buy spectacles with Blu-ray protection, and these are much, much better than your run-of-the-mill spectacles. Then there's that one they call what? Chrono what?
Yeah.
There's a chrono thing.
Oh, photochromatic.
Yes. So do we need this essentially, or are these just sales terms?
Some person has what is called photophobia. He can't look to the light well, or the rays of light affecting his eye.
Yes.
So in these conditions and on these persons, it is better to have a glass with a photo gray. Photo gray or photo brown. This will protect the eye from the rays, and not making the person exposed to the rays, especially have an allergy or a photophobia. This is what is occurring in many persons, especially with allergic patients.
Yeah.
Okay. Contact lenses.
Yes.
Also, like you said, a vision aid for refractive errors.
Yes.
What exactly is their function? What do they do?
Yes. What is done by glasses, it was occurred by the contact lens. The contact lens is correcting the error like what happened with the glass. If the patient has myopia or hyperopia or astigmatism, as we correcting with the glass outside the eye, we putting the contact lens directly over the cornea. The advantage is giving a wider field of vision because the glass you have a frame.
And there's some
affecting,
loss.
Yes.
Yeah.
And also more cosmetic in some patients. Some patients not accepting to wear a glass.
Yes.
They want to do nothing cosmetically good for him. So the contact lens is another modality, correcting the vision instead of glasses, especially, as I said, in some patient practicing sport. He can't playing football with the glass, but with the contact lens, it's okay.
Okay. And then, what is the guarantee of success for surgery? It's a delicate thing, this eye.
Yes.
So how sure are you that you go into the surgery? You can only tell if it works when you come out.
It's true.
You know?
Or if it doesn't work.
If it doesn't work.
Because you don't come out.
Yes.
So what's the guarantee of success?
Yes. For this reason, there is a preoperative preparation for the patient. We must assess the patient before deciding surgery for him. There is a specific criteria must fulfill in the patient to do surgery. The myopia must have a limit. I can't do LASIK now in a patient has minus 15 or minus 20 because it is limited to minus 7, minus 8. And also, if the thickness of the cornea is a very, very thin, I can't do LASIK for him. So I must measure the thickness of the cornea and the curvature of the cornea. For this reason, before deciding surgery for a patient, I must fulfill all the criteria to be sure that the surgery will be successful for him.
Okay.
Either depend on the degree of error of refraction, the thickness of the cornea, or the age of the patient. It is not advisable to do LASIK for the patient before stabilization of vision, as I said, before 20.
Okay.
Because some students coming, I want to do LASIK like my daughter, or like my sister. I want to do LASIK like my... No, it is better to wait for LASIK surgery until stabilization of vision, which is around the 20.
So what exactly happens during LASIK? What do you do to the eye that would then correct the vision?
Yes. When I wanted to correct myopia, for example, by LASIK, the myopic patient has more curvature in the cornea. His cornea not with the normal curvature of a normal person, but the cornea is slightly bulging in front. What happened by LASIK is using excimer laser for doing ablation of the cornea. We doing
English
flattening of the cornea. Flattening of the cornea. And instead of the cornea is slightly bulging, we taking part of the cornea, very minimal microns from the cornea, so causing flattening of the cornea and returning the patient as if a normal person.
And how long?
With a normal curvature.
Okay.
If we do LASIK at 20s or after 20s, will be stable all over the life.
Okay.
Many patients I did LASIK for them in Egypt after stabilization of vision. Until now, he is around 50 or 60. He is okay.
And it's fine. And how long does the surgery take?
10 minutes, 5 minutes.
5 minutes?
Yes.
And okay.
Yes.
So after the LASIK surgery, how long does it take for you to now be able to see properly?
We're asking the patient to stay during the day of LASIK and coming the next day to see him. During the first day, he is seeing well, but with a slight pain, slight blurring of vision. The second day, everything will be okay, as if he has his glasses in the eye.
Oh, okay.
Interesting.
Yes. Groovy.
Yes.
All right, 15 minutes. That's the maximum if you're having a bad day. The question I want to ask now is, what is the recommended fix as people are listening to us who wear glasses already or who are like Dennis going into their 4th decade, which he denied earlier today. But
I've already entered.
so the question is, what would you as a doctor tell someone that is the preferred and safest route to take? So those of us who wear glasses, is it safer or is it safer to actually just come in and do LASIK tomorrow so that when I appear on Monday, I'm a new man?
My advice for any person to consult his ophthalmologist to determine what is the best way for him for correction, either with glasses, either with contact lens, either with surgery. So the consultation of the ophthalmologist is the best way to know what you have and to know it is necessary to do something or your eye is perfect. Some people coming for checkup and I find the vision is 6.6, everything is okay, and you see perfect vision. I told him, your vision is a perfect. Seeing you after 2 years as a checkup.
Okay.
So checkup can discover if the person having something error must be corrected or is a completely normal person.
All right.
Okay.
Connect for me the connection between headaches
Yes.
and eyesight.
Yes.
Because sometimes for people like I who wear glasses, I can wear certain glasses, same power, same whatever, and then I get headaches still.
Yes.
Well, I've had them ever since I was a kid. So how do you mitigate against the headache that is caused by natural I don't know whether it's attrition of the eye or whatever, but what's the connection and what's the solution?
Yes. Really, headache is a major complaint not related only to the eye, but related to other specialties. As regarding the eye, we exclude all the causes of headache related to the eye. Either error of refraction, which we are speaking about, because the patient has error or defective vision. He tries by his eye muscles to see things well. This contraction of the muscles is the main cause of headache. Or sometimes headache related to other ophthalmic causes. All patients of glaucoma, especially one type is called the closed angle glaucoma, the first complaint is headache. Or the patient with papilledema or other causes related to the brain affecting the fluid around the optic nerve. All these cases are causes related to ophthalmology. But sometimes that patient coming with headache and he imagines that the cause is the glasses or error of refraction. I discover it's everything related to ophthalmology is okay. I asked him to go to another specialty like ENT. Sinusitis is a main cause of headache. Or anemia, I direct him to the physician to doing analysis. So we must exclude the causes of headache related to ophthalmology, or if the patient is completely free as regard to ophthalmology, I can direct him to other causes of headache.
Okay. So at the Royal Eye and Ear Hospital, Ashihundu, is anybody who comes in then is able to get the services they need when it comes to refractive errors? Is across board, would everybody then be able to access the right services?
Yeah, good morning again. At Royal Eye and Ear Hospital, like I've said, we specialize on eye and ear, and we have high-end machines to examine both eye and ear problems, and anybody across the board, be it from the low class and high end, we see all types of patients.
Okay.
Yeah, we see all types of patients, and we also run a program we call CSR. CSR, last year we partnered with the Islamic Relief Canada chapter, where we did 400 free cataract surgeries for patients from across the counties.
Okay.
Yes.
So then also somebody can come and get their eye test if they needed glasses, if they needed contact lenses, all of that can be done right at the hospital?
Yes.
Okay.
All of that can be done at the hospital. We are open from 8 a.m. to 5 p.m. That's from Monday to Friday. Then on Saturday we are open until 2 p.m. So anybody walking in, we have our consultants seated waiting for them.
Okay. So Doc, as folks age, how often should they be coming in for tests? Because things like cataracts, like Ashihundu has just mentioned, come into play. Glaucoma also come into play. How often should we come in to have those looked at to avoid such?
We must advise the patient to come as a consultation, and any complaint related to vision, either diminution of vision or defective vision, he can consult his ophthalmologist. And it is better to do a revision every 2 years, to be sure that nothing occur. But any complaint occurring during this time, of consultation, he must ask his ophthalmologist about.
Okay. Another thing is for sunglasses,
Yes.
usually we wear them as a fashion statement and not really realizing the damage that the sun can actually cause to our eyes. Is there refractive loss or error that can come as a result of sun damage?
Really, the sun with the ultraviolet rays affecting the eye, and especially for many patients has allergy to ultraviolet rays, he can't withstand looking to the sunny places. It is advisable for these persons especially to wear an original sunglasses. To this will abolish and avoid ultraviolet rays to enter to the eye and causing any damage.
All right. So even as we look, I mean, there are options for, you know, what you can do, vision aids that you can have. Is it possible that you get to a place whereby there would be no remedy for the error that is presenting? Or is there always a remedy for any error rather that is presenting?
Any person coming and we discover whatever the error he has, we can find a solution of him. Either this error corrected with glasses, he can find the glasses in the optic. If he want to take a contact lens, we will ask for a contact lens for him. If he decide to do a refractive surgery, and as I said, he is suitable to doing refractive surgery, we can doing the investigation and the preparation for him to doing refractive surgery.
All right. It's been most enlightening. Thank you so much for being here this morning. One thing that we can't ever run away from in terms of, vision and more people being affected by it. So we want to thank both of you for being here on Healthy Friday this morning. Ashihundu Khayumbi is the General Manager at the Royal Eye and Ear Hospital in Parklands, and Dr. Abdelalim Tolba is a consultant ophthalmologist and Egyptian eye professor. Thank you so much for being here this morning and sharing with us, looking into some of those issues. Very important that we do, I think, that we don't run away from some of these issues, but that we talk about them, and that always when there is help needed that we can find it. So thanks for being in the hot seats this morning.
Thank you very much.
Thank you.
Thank you.
This is the Situation Room, the only way to start your day.